Welcome. Have you ever felt a burning, stabbing pain in your feet or hands, seemingly for no reason, or experienced digestive issues, a racing heart, or even dry eyes and mouth that just won't go away? It could be a sign of something called autoimmune small fiber neuropathy, a condition where your immune system mistakenly attacks the delicate nerve fibers responsible for transmitting pain, temperature, and autonomic functions. In this video, we'll explore this complex condition in detail, from its causes to the latest treatments. So, what causes autoimmune small fiber neuropathy? While the exact cause remains somewhat mysterious, it's understood that the body's own immune system is the culprit. Instead of protecting the nerves, the immune system mistakenly identifies them as foreign invaders. This autoimmune response can be triggered by a variety of factors, including underlying autoimmune diseases like Sjogren's syndrome, lupus, rheumatoid arthritis, or celiac disease. In some cases, infections like Lyme hepatitis C can also play a role. And sometimes, despite thorough investigation, the trigger remains unknown, classified as idiopathic. Let's delve into the pathophysiology, or how this disease actually affects the body. Small fiber nerves are unmelanated or thinly myelinated nerve fibers that transmit signals related to pain, temperature, and autonomic functions. When the immune system attacks these nerve fibers, it damages them. This damage disrupts the normal transmission of signals. This leads to the array of symptoms we'll discuss shortly. The damage can range from subtle nerve fiber loss to significant degeneration, impacting the functionality of these essential nerve pathways. When we look at the epidemiology of autoimmune small fiber neuropathy, or how common it is, it's challenging to give exact numbers. SFM is likely underdiagnosed as many cases present with vague or seemingly unrelated symptoms. Estimates suggest that SFN, in general, is more prevalent than previously thought, and the autoimmune subtype accounts for a significant portion of SFN cases. It affects people of all ages, races, and genders, although some studies suggest a slightly higher prevalence in women. The incidence appears to be rising, possibly due to increased awareness and improved diagnostic techniques. The signs and symptoms of autoimmune small fiber neuropathy are diverse and can significantly impact a person's quality of life. The most common symptoms include burning, tingling, stabbing, or electric shock, like pain in the feet and hands. This pain is often described as disproportionate to any apparent injury. Other symptoms may include temperature dysregulation, such as feeling excessively cold or hot, even in comfortable environments. Since small fiber nerves also control autonomic functions, patients can experience issues like dry eyes and mouth, bowel and bladder dysfunction, gastroparesis, orthostatic hypotension, dizziness upon standing, and excessive sweating or lack thereof. Diagnosing autoimmune small fiber neuropathy often involves a combination of clinical evaluation and diagnostic testing. A thorough medical history and physical examination are crucial to assess the patient's symptoms and rule out other potential causes. The gold standard for diagnosis is a skin biopsy. A small skin sample is taken, usually from the lower leg, and analyzed under a microscope to measure the density of small nerve fibers. Other tests may include quantitative sensory testing (QST) to assess the patient's perception of pain and temperature, autonomic testing to evaluate the function of the autonomic nervous system, and blood tests to look for underlying autoimmune diseases or infections. While there isn't a formal classification system specifically for autoimmune small fiber neuropathy, it's important to identify any underlying conditions that may be triggering the autoimmune response. This will guide treatment decisions. For example, if the neuropathy is associated with Sjogren's syndrome, treatment will focus on managing both the Sjogren's and the neuropathy. In cases where no underlying cause is found, it's classified as idiopathic autoimmune SFN. Differentiating between different causes is crucial for tailoring treatment strategies effectively. Treatment for autoimmune small fiber neuropathy aims to alleviate symptoms and address the underlying autoimmune process. Pain management is a primary focus, and this can involve a combination of medications such as anticonvulsants like gabapentin and pregabalin, antidepressants like amitriptyline and duloxetine, and topical treatments like capsaicin cream. Immunomodulatory therapies such as intravenous immunoglobulin (IVIG), plasmapheresis, or immunosuppressant drugs like methotrexate or azathioprine may be used to suppress the immune system's attack on the nerves. Physical therapy and lifestyle modifications, such as regular exercise and stress management, can also play a supportive role. Currently, there are no proven methods to definitively prevent autoimmune small fiber neuropathy. However, managing underlying autoimmune diseases and promptly treating infections may help reduce the risk. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking and excessive alcohol consumption, can also support overall nerve health. Because the exact causes are not always known, prevention remains a challenge. The prognosis for autoimmune small fiber neuropathy varies depending on the severity of the nerve damage, the presence of underlying conditions, and the effectiveness of treatment. Some individuals may experience significant improvement with treatment, while others may have persistent symptoms. Early diagnosis and treatment are crucial to minimize nerve damage and improve outcomes. Ongoing research is focused on identifying new therapeutic targets and developing more effective treatments for autoimmune neuropathies. Recent studies have explored the potential of novel immunomodulatory agents and targeted therapies to selectively suppress the autoimmune response while sparing the rest of the immune system. These advances offer hope for improved outcomes and a better quality of life for individuals living with this challenging condition.